All right, thanks everyone for joining today. We have a few slides, like Amanda said, that we'll go over. But yeah, our hope today is really just to connect with you all and see what sort of questions you're having with the new measures. I know Amanda emailed out earlier this month, seeing if anybody had questions on the new measures that we could talk about. And there was some interest about the hybrid measure, the hybrid hospital all-cause readmissions measure, I believe is the formal name. So we can spend some time talking about that, but then also if there are any other questions about any of the new MBQIP measures, we can discuss those or learn from your peers if there's any sort of challenges that folks are having or want to bounce ideas off of the peers in your state and other critical access hospitals that are working on reporting these measures. That's sort of, the intent of this call. And again, we might not have all of the answers to some of the questions you may have. These are very, in-depth, complex, detailed specifications for the measures we might not be able to answer, but we are definitely available to receive those questions, and then we could follow up after the event as well. So we do have some slides to present. I think Courtney, Ryan, I see you're on. Did you have those or?
Yeah, are you able to pull them up by chance? And then, did we want to start with, first of all, good morning, everyone. Sorry. Did we want to start with just going over the hybrid, or we have some questions that we just kind of put onto a slide? We can start with that too, or what makes the most sense?
Yeah, I think, go ahead, Amanda.
Well, I was gonna say, I think maybe if you wanted to start out with the slides, I think that would be fantastic. And then maybe that would prompt some more questions based off of those slides. So
sure.
That would be great.
So maybe, Elena, if you're able to share, let's see, we put the questions on slide 59.
One second.
And there may be other questions. These were just kind of some things we were thinking about that could maybe help prompt discussion, as Elena said.
Yeah, I guess as we get those up, Anne and Courtney, do you want to introduce yourselves and sort of explain your role in ARKITA as well for the folks that may not have joined the new measures presentation that we gave last month?
Sure, yeah, that's a good idea. I can go first since I'm already talking. My name is Courtney Ryan. I'm a program specialist here with Telegen on the ARKITA team and support and with providing technical assistance out to you all. So I'm located in Colorado. I apologize, I'm not on camera. I live in a small mountain town that has terrible internet and terrible bandwidth. So I apologize that I'm not on camera with you guys.
Hi, everybody. My name's Ann Logus. I'm a nurse. I've been with Telegen since 2017. Before coming to Telegen, I was a critical access hospital quality improvement director, submitting MBQIP and working on quality and meeting the conditions of participation, all that kind of stuff at a critical access hospital here in Iowa, where I live in rural Iowa. And I provide direct support to Amanda and you all as you're working to learn the new measures and submit them and the entire core measure set as well. So it's great to be here with all of you, and it's nice to get to know you and be in this more informal setting as well, so that we can hear from you. I learn from you all so much in my work and in our work that please do not hesitate to speak up and talk because we just really learn from you all very much.
So these were some of the questions that we were just kind of brainstorming internally. And so again, I don't know if this is a good starting point here, but one of the things that when we've been presenting on the new 2025 MBQIP core measure set that we've been really kind of emphasizing is how we can really be taking this time this year to prepare to report for 2025. And the first measure that will be due in September 2025, which is the hybrid hospital-wide readmission measure. All of the others are due in 2026, but just kind of wanted to get a sense from you all as we think about preparing and what is it that we need to feel confident moving into the new 2025 course set. Like what do you need as teams to feel ready for that? Are there like vendor needs, IT needs, better understanding of measures? What would be helpful for you all? And maybe you don't even know like what you don't know or know even where to start. And that's okay to say too, but just again, kind of thinking about what is it that you need to begin to feel confident to report in September.
Hi, this is Monse from Borgesley. I just have a question related to the social determinants of health and health equity. There is a difference between the two. And I know we are starting to collect data for the social determinants of health, but I don't know what specific is the health equity looking at different than the social determinants of health.
Yeah, I can take that question. They are different. So the social drivers of health measure is measuring whether you are screening patients for 5 health-related social needs. And there's a lot of flexibility with how a hospital can collect that. There are screening tools that are suggested, but a hospital can pick whatever screening tool works best for you. And so it's screening whether you asked patients if they have transportation, safety, housing, or food insecurity. And it does not measure what the patient answers. It only measures if you are screening patients, if they have those health-related social needs. So it would be something a hospital could collect electronically or just manually. And what's submitted at the end of the year is numerators and denominators for each of those 5. The other screening for social drivers of health is if the patient screened positive. So essentially, really, there's 10 numerators and denominators if you include all of those measures. 1, if the hospital screens each patient. 2, if the patient screens positive. And we know that you and your hospitals are doing things and referring patients to resources in your community, but for the actual measure, it's just measuring if you screened them and if they screen positive. Does that help answer your question?
Yes, and we are currently doing this. So I get a denominator, how many patients we screen, how many answer positive to the 5 different questions. But this health equity piece, and where you're kind of capturing what counties are in more need. So that's the piece that I right now I don't have data.
Yeah. Okay. Elena, can you move the slide deck to maybe the first health equity one, and I can just go over that for you really quick. Let's see, go back to
What?
Yeah.
Yeah.
Go back
Yeah.
one more.
It's when, yeah, they said they had.
I mean, if you're
so,
gonna talk
okay.
about it, I can't wait. I just
Yeah.
By 10:30, but I was planning to take them. I didn't even think about
So
using
make
them.
sure that you are on mute, everybody. Just double check that your bottom left-hand corner of your Zoom screen, you've got a line over your mute button. Thank you. So go back one, let's see. I'm trying to get to the 9 elements, Elena, the screen that shows the 9 elements. Or 5 elements, thank you. So This these will be attestation questions. So you're going to have questions in all of these 5 domains when you open up your hospital quality reporting tool. It will ask you yes or no questions in each of these domains, and you're going to be gathering the answers for this. Like with it, it's going to be, looking at what your hospital's strategic plan or mission statements, or what you are collecting as far as the quality data that you're looking at in your regular quality meetings. When you're looking at, for example, like readmissions, do you when you do that as a team, do you stratify that and look at other specifics of those readmitted patients? What's race, age, language, ethnicity, things to that nature. And so it is attestation. So you are not doing like chart abstraction. You aren't gathering numerators and denominators. You're looking at your hospital's processes like as a whole. So it isn't as like specific. This is more of a, there might be some thought, or am I meeting this or am I not? It's not as black and white as some of the like readmission specifications. You're kind of analyzing, does our hospital strategic plan include this? Does it not? So it might be a little bit more difficult in that sense, but at the same time, it's great because every critical access hospital is different. You all do your quality meetings different. You all have a different strategic plans and mission statements, and it allows for some flexibility in that area. Does that help?
Yes, yes, it does. Thank you. Thank
You're
you very
welcome.
much.
Yeah. Let's go back to maybe our, I know Courtney asked a question, and maybe someone else has a question similar. Like what measure gives you angst the most? What one keeps you up at night? Or just any type of question. Feel free to come off mute and ask away. Let's see, what slide did we have our prompts on?
I think it's slide 59. And I just realized, Elena, our slides are not numbered. So maybe that would be
There it was. Thanks everyone for flexibility and just, yes. Yeah. There it is.
So I do see a question in the chat. Do you have a slide demonstrating all 2025 measures and submission due dates? We do. And we have a document. I can post the link of the document into chat. Bear with me just a second. Okay. I just posted a link into chat for the 2025 submission deadlines, which will have all of the measures, including the new ones and their measure IDs and counter periods and all of that. This one here might be helpful. It doesn't have the exact due dates on here, but we can send this slide deck out to you guys. This is similar to the presentation we did for you all previously, which has each measure broken down with the measure specifications and due dates and all that kind of stuff. But here's sort of a quick summary. All of the new measures that will begin in 2025 are in blue, and the current measures that you all are familiar with reporting already are listed in the grayish black color. And so just a quick note on here, of all of the new measures, they'll all be reported annually. So the ones that you've been reporting quarterly, you'll continue to report quarterly, but the new measures that will be part of the 2025 MBQIP core measures that will be reported annually. And the first one, again, will be that hybrid hospital-wide measure, which is due in September of next year, and will be for a encounter period of July 1st of this year through August 31st of next year. The others will be reported in 2026.
And just to kind of piggyback onto what Courtney's talking about, so we did record a new this slide deck that we're referring to here. We have a presentation that covers all of this. We've recorded it, and it's going to be coming out in the newsletter within over the next week or so. And so it also has on the beginning slide, like the time frame in the presentation where we talk about each specific measure. So you can cruise through it quickly or watch the whole thing, whatever you choose. But please watch for that resource. It will be helpful and similar to what we covered in the new measures presentation. It's been updated, and we've taken feedback from hospitals and flex coordinators to make updates and improvements to the presentation. So if you did watch it previously and attend with us the first time, just know that this recording is worth looking at again, because we've taken everybody's feedback and improved it. So watch for that in your newsletter too.
Yeah, I was also going to add, or ask Amanda, did you record the presentation that we had? Because I'm wondering if that's available.
Yep. So the previous presentation that you gave in January is recorded. It's on the website, and all links are there as well. So what Courtney has added to the discussion or the chat box, that is on the MCRH website. I'm going to go ahead after we wrap up here today. I'll give you a link to where that can be found, as well as additional resources. But I did want to point out that while the reporting doesn't technically start until 2025, there is opportunity to start reporting in 2024, and we are highly encouraging that you start reporting measures in 2024. So the hospital commitment to health equity, that was starting, there's a starting date. The deadline is May 15th of 2024. SDOH, if you are tracking that, you're able to submit that by May 15th of 2024. That's for calendar year 2023. So while these aren't technically reportable until 2025, you have the opportunity to start reporting on them now. And the MBQIP is highly encouraging that you do start reporting on this, so that you get the practice of doing that when 2025 begins.
Yeah, just to kind of tag on to that, Amanda, Elena, could you go to slide 52, please? And I know it's probably hard since you can't see the slide numbers, but it's near the end, and it's just a summary slide that shows the measures that are available for reporting right now. So we've been encouraging folks to connect with other peers that may already be reporting these measures, so that you can, pick their brain about their best practices around processes and workflow, and how they're reporting these measures, so that, again, you can kind of test out some different processes and get some good systems in place now while they're available, as well as just collecting the data, not only for that, but perhaps you might want to improve on the measure itself. And so you've got some time to put some quality improvement projects in place to improve those measures if that's needed. Thanks, Elena. So all these measures, these are all of the measures. These are the ones that are available for reporting now. So again, like especially that hospital hybrid hospital-wide measure, if that's something I know that maybe some of the folks here were kind of a little bit concerned about. So this is available to start reporting and practicing now, as well as, again, connecting with peers that are already doing this, so you can kind of hear lessons learned and not have to start from scratch or reinvent the wheel on different processes or best practices. Are any of you reporting any of the new 2025 measures already? So for this slide, that would be those that are in blue. Thanks, Jen. I see not yet. Yes, Julia. Which one are you reporting on, Julia? Just curious.
Safe use of opioids, we have been reporting on the quality infrastructure is done. That was just, completed in November. Hospital commitment to health equity, we've been started since 2023. It's just a matter of doing the submission. We haven't completed yet. SUH and the SUH measures are the same. So we're geared up and it's just a matter when that opens for us to report. Hybrid is the only one that makes me nervous. We haven't dove into that one too much yet.
Gotcha. Well, that's great that you're reporting so many of these already. Do you mind sharing just what makes you a little bit nervous? Maybe we can talk through some of that.
I think it's just me understanding the logistics behind it more than anything. But because it comes, I think I'm going to need to partner with our EMR person as we share Epic with a larger facility. And so it's just a matter of collaborating and coordinating those efforts, I believe, overall. But I just need to understand the logistics a little bit more with it, the technical side.
Yeah, sure. So there is in that recording and in these slides I think it's on slide 51, Elena, has just some different resources that might be helpful as you're going through this, but some resources around the measure specification itself, how to, when you're working with your vendor or your IT department, how to set up that QRDA category 1 file and make sure that everything, all of the clinical core data elements that you're going to be extracting from your EHR, that those are able to, that those are mapped and able to be pulled out and uploaded into that QRDA. So there's some submission guides, implementation guides. There's a schema in here that IT folks will understand, so that some of these might be helpful for you. And then if you'll go back just a couple slides, Elena, slide 47 just kind of gives that visual for, let's see, just I think one more before this. Yes, so this just sort of gives that visual of the core clinical data elements on the left-hand side. That's what you're going to be pulling out of your EHR. And then on the right-hand side is what CMS is calling the linking variables. So these are the data elements that will be put into your claims. And then CMS will marry the two on the back end. So as long as you've got all of your lab and vital, signs and things like that that you're able to pull out, and then you've got these data elements on the right-hand side in your claims data, they will calculate everything on the back end and put it through this risk standardized algorithm that will then calculate that rate for you. So this slide might be helpful just to reference in terms of what the data elements that you'll need to be kind of paying attention to.
Yeah, that slide is very helpful. Thank you.
Sure.
Courtney, did you want to mention the HQR support video?
Oh, yes. So on that slide, poor Elena, do you feel like you're just going back and forth? Slide 51, there's a video, a YouTube video. It's really short, but it's fantastic. It's the third bullet point down there that says how to submit hybrid measures and view outcomes. It's just a couple minutes long, comes from HQR, but it's fantastic to figure out where you go within that platform, what you click on, and all of those kind of things. So check that out too. That might just help ease a little bit of angst. And it also shows you like where you can go to check your outcomes to make sure that the files you uploaded, that they were successfully uploaded. And then it gives you kind of a little summary or synopsis of where you are in terms on that measure. Like 90% of your residents had vital signs or had laboratory values that were submitted for this. So it gives you a sense of where you are as well. So that's a great video I would recommend.
And I'll add all of these links to an email that will follow shortly after the call this afternoon. CMS just sent out these links as well. I believe it was yesterday, and sort of how to upload a population sample file, how to submit HCHE and SDOH data, and then they also shared on how to submit the hybrid measures and view the outcomes. So I'll add those to an email and to the email as well, so you'll have those resources.
Any other measures that are kind of giving folks some angst, or that you're just not quite sure where to start, or? Maybe, Elena, we could go back to that prompting question slide, just slide 59.
Cindy mentioned definitely not sure where to start. And I think just to kind of address Cindy, I know how you feel with this. And I think that's why we bring the readmissions measure forward is maybe a good place to start, or just a suggestion, is to just letting yourself dive into that resource page for the readmission measure. Keep that this slide deck and that slide where we show the readmissions resources, so that you don't you can get down a bunch of rabbit holes really easy. And let yourself do that when you're going through and trying to understand that measure, but always come back to that resource slide for the readmissions. And just a great suggestion is to start with that readmissions measure, since it is the first one for that is required for MBQIP participating hospitals, knowing that Amanda wants you to start with a lot of them. But this one is much different than what you are familiar with. And so I would just suggest letting yourself read through all of those resources and start with the readmissions measure. That's a great place to start. I don't know if that helps, Cindy.
Yeah, and I don't know if this might just be me, but I feel like I always have the best intentions to try to, take on everything. And sometimes, other things come up, or you end up putting up fires, and before you know it, 5 months have gone by and you haven't had a chance to do anything. So perhaps setting aside some time on your calendar that you can just block out, and you're going to use this time to dedicate to understanding the measure specification, and then getting, another calendar time where you're connecting with your team, your IT, whomever, just start to get those conversations in place, but just sort of trying to be intentional about setting that time aside, so that, again, because we all think that we're going to get everything done in a day, and we never can, because there's just always too much and we wear so many hats. So maybe blocking out some time, like on a regular cadence, that you can spend some time and just take it in little chunks at a time and measure by measure. So like Anne said, focus with that hybrid measure, perhaps, if that's something that you're not familiar with yet already, or in a good position to report on, since that is the first one. And then once you feel good with that and you feel like you're in a good place, then move on to the next measure. And I mean, you've got some folks, Julia, in here, and likely other hospitals that are already reporting on some of these. So would definitely encourage you to reach out to them, because they're going to be able to give you that true, like, boots on the ground feedback of, this is where we started, these were lessons learned, this is the process, this is who does this is when we do this. All of those kind of things, I think, would be also helpful. But it is overwhelming to just, like, where do I begin?
Another thought for where to begin too is thinking of the team members that you need to engage at your hospital. Let give the social determinants of health information to your social worker, that they have the slide deck or they have the ability to watch the recording for those, just so they're up to speed on that. And like Courtney said, share the readmissions information with your IT and EHR teams, just so they can start absorbing the information on these new measures as well. Safe use of opioids, if that's your pharmacist, just ask them to, listen to the recording of the presentations and look at the slide deck, give them the resources slide so they can, do their own investigation on these new measures as well. Just so that you aren't, engaging them at the last minute, give them opportunities to explore on their own as well. And that's just getting out these resources that we're going to be sharing with you. So yes, Debbie, we will get the slide deck to you for sure. The health equity measure, if you have a regular quality meeting that you lead or that your medical staff leads, share with them that you will need support with them on the health equity measures. You might be engaging them to help answer whether yes or no on those questions. So those team members at your hospital would be great to engage at this time as well, and just start educating them on these measures too.
That's kind of like an all hands on deck approach. Like, don't take all of this on just your shoulders.
Yeah, definitely.
I see another question in from Debbie about, can you describe what is Telegen Arquita? So Elena, maybe you could go to slide 3. I'm such a visual person to have this, but basically Telegen has a cooperative agreement with the Federal Office of Rural Health Policy for this Rural Quality Improvement Technical Assistance Center effort. And so our role is really to just come alongside Amanda and your teams to help complement and add support related to quality reporting and quality improvement. So things that like resources and services that we provide, you can kind of see on the right-hand side there. We provide a monthly newsletter. We work to put together up-to-date resources, guides, and tools, kind of like the links we put in earlier around the 2025 submission, reporting and submission deadlines document, or the document that has all of the measures listed out. So we put together resources that help you with your quality reporting efforts. We can provide one-to-one technical assistance. So maybe you need help understanding the measure specification or walking through how to navigate through CART or setting up a HARP account or understanding how to submit the measure itself and those reporting channels. So we can provide support for that. Or maybe it's just quality improvement in general. Like I know that we need to improve on this performance metric, but I've never done a root cause analysis, or I'm not quite sure where to start in designing an effective performance improvement project. So if it's quality improvement skill sets, just in general, and getting some support around that, we certainly can help with that too. Learning and action webinar events. So those are like the presentations that we provided back in January. So if there's specific requests that you have around that. Recorded trainings. I think Anne mentioned earlier, we just recorded a presentation on all of the new measures that goes into great detail. So that will be available next week, and we'll continue to do recorded trainings on topics as people share, with us what they need. And then the bottom there is just a couple links to the Task Rural Center website and the Arquita website, which just has all of those different resources that we've kind of been referencing. So in a nutshell, our role is to come alongside Amanda and help you all feel prepared and ready and successful in reporting for MBQIP.
Anybody else have any questions? I'm sure if you have a question, someone else has it too. Don't be shy.
I had a question. So in regards to the SDOH measures and the reporting, did CMS provide, or is there a tool that if a facility doesn't currently have their own tool to use, is there a tool available to them? Whether it's an Excel spreadsheet or recommendations on how to collect the information?
Great question. And our team recognized that right away from feedback from you, Amanda, and others as well. We are actually putting a spreadsheet tool together right now. And so please watch our newsletter. We will definitely get it out to all of you that way. Just a suggested thing that could, a hospital could modify or change, but we'll throw it out there because I do think that's a great idea. A quality leader gathers data, and to see it in a spreadsheet on what how where it goes and how it's organized can really communicate the specifications of the measure in a different way. And so we are developing that as we speak, and we'll get that out to you. But thank you for that suggestion, because maybe we hadn't thought of that. And those are the exact type of feedback we need from you and your hospitals, because just to be able to visualize it from the boots on the ground perspective of a tool that's needed. And that's what we can do for you as well, is to build that for you and to offer that. So thank you for that.
Yeah, I'm hoping that that tool is ready in the next week or two. It's currently with our communications department. We sent it out to a couple hospitals that had graciously volunteered to sort of test it out for us. And we incorporated the feedback that they gave us. And so anyway, we'll be sharing that. And if you all have additional feedback once you receive it, that would be great, because we want it to be meaningful and useful. So. I see another comment from Jennifer, just saying, don't wait to have your IT department start working on the hybrid readmissions measure. We had to hire a consult to build the extraction file for our EMR. It was very time consuming, even for the consultant to build. So yes, don't feel behind, Cindy, you have time. So just take advantage of the time now, and you've got a network of support between Amanda, your peers that are on this call, those that this call, and the Arquita team. So just start chipping away at it, and maybe finding a time to put on your calendar to connect with your teams and start to go through some of these things. Listen to the recording. The recording that we put together, we added times for each measure section, so you could just skip right to the hybrid hospital-wide readmissions measure, listen to that, and then start to have some questions, or start to jot down your questions and concerns, and then, reach out to your network. So don't feel behind. You've got time.
And one of the perks of you all filling out that critical access quality infrastructure assessment in November and December, it provided us with information that can group you all by your vendors, whether it's your HCAHPS vendors or your EHR vendor. And so, if someone's having trouble with something, we definitely can pull together cohorts. And so if you do have Epic, maybe we need to pull together an Epic cohort where you all get together and figure out best practices and how you did how you built that download for the hospital-wide readmissions. So, that's something to think about as well. But thanks to everyone who did fill out that and provided us with that information, because now we know who aligns with which vendors, and it just makes it an easier process to pinpoint who your colleagues are who have the same vendors as you do.
So Amanda, exactly what you've just described is happening in the chat. Like, the hospitals are talking to each other. I see, Jennifer Bentley, please keep your Michigan hospitals up to date on what you find out from your vendor. Because, Jen Monzo wants to know. So these are the best conversations that you guys can get into the weeds with these and share the examples, and to just keep everybody posted on how you're working through these challenges. That's just perfect. And exactly what you just described, Amanda. So perfect example there in the chat. Keep it going. Keep talking to each other. Any other questions or suggestions for us, or just feedback for the Arquita team? Amanda, is there anything that we haven't specifically covered or you'd like us to focus on a little more?
I was having trouble coming off of mute. I don't necessarily think so. Other than maybe I'm looking at the measures right now. Other than I would say the quality infrastructure and sort of what that looks like on an annual basis, because we all know that that's not a one-time request and that it'll be coming annually, and potential changes or tips and tricks to take the information that you use this year and pulling it over to next year as well. So maybe just sort of hitting on that one component there, because it's not a one and done.
Mhm. Yeah, I mean, taking specific questions out, it's a, you know, I mean, you could use it as a baseline, from a hospital level perspective of, here's how we answered this question this time. And by the next year, we want to be able to answer or click all the boxes. And in some of those, some of the questions are worded a little different, but I mean, I would suggest it's definitely something that a hospital should print out and keep on their desk forefront and take to every quality meeting, share with different committees in the hospital, so that they can see what's been answered, and have a quality director from a hospital level get feedback from those at the patient's bedside for you know why was it answered this way and how can we improve, and just sharing it hospital wide with everyone would be a great suggestion and a great place to start, because I know each question will stimulate a lot of questions within a hospital, and dig into the weeds of how that was answered. I'm just speaking in general terms, but it's going to be a fabulous tool. How it's going to change next year, that's a great question that we will ask. And I don't know, will the questions change? Will they stay the exact same, so that you could use this year as a baseline and then watch it as the years go by? I have that question. That's an FMT question, but that's something we need to bring back to you, Amanda, in your hospitals, so that you can kind of plan for how you use this as a tool going forward. And if there's anything else, specific to how this looks in the future, if you have any other specific questions, let us know so that we can ask those and bring those back to you, because we're learning this with you as well on this new measure too.
I will just note to the group that's here, the critical access hospitals that have joined today, is that we do have the download. We are going through it thoroughly. We're working with the MBQIP executive committee on how best to present this information to you. The goal is to have the data compiled and presented at our May in-person meeting. So we are, as diligently as you and as hard as you worked on entering that information, we want to be very thoughtful about how we present that information to you, and bring the best data and takeaways from that assessment back to the entire MBQIP. So we do have it. We've been digging through it. The executive committee should have a final determination as to what that presentation will look like for in May. So it's exciting to see all the great information that's in there, and what we're planning on sharing here with you in May.
That's awesome. I'll just tag on to that when we talk about like some of the benefits of participating in MBQIP, and for you all to be able to showcase your stories and the value that you bring to your rural communities, I think this is a great place to get some of that content for your story, because you can be identifying, hey, community, we're doing really well with this, and here's our story behind this. And then, hey, community, we found some opportunities we want to improve around XYZ. We'd love to hear your feedback and thoughts around that. And then being able to demonstrate how you incorporated that, I think goes a really long way. So I think there's some good nuggets that you can pull out of this to be able to help demonstrate the value of the quality of care that you all bring, and all the hard work that you do every day, day after day, all day.
What is an FMT? FMT is the partner that developed the quality infrastructure measure and assessment. They are the partners that provide the MBQIP reports. On the Flex monitoring team, as thank you, is FMT, and so they are the team that pulls all the data from CMS, from NHSN, from the quality infrastructure, and puts it into the reports for you. Anything else? Our team really enjoys having this contact with you. If there's anything after our meeting today that comes up, please let Amanda know, let us know. We want to hear from you. If there's a question you think of later, please don't hesitate to get it to us.
Yeah. Thank you so much for being here with us today and presenting this information and answering all the questions that we have. I'm sure there's going to be more questions as we keep continuing on rolling through the new measures. If you have questions, or you want some more answers on any specific topic, know that you can reach out to the Telligent team directly. You don't have to come through me to reach out to them. While we appreciate knowing what your question is, just so that we could share the answers more globally, you don't have to reach out to me to get the answers question. And it looks like Courtney put the email contact in the chat. So if you have a quick question, please feel free to reach out to them directly. And if you want, you can copy me on it, and we can start sharing those answers with the larger group.
And just to kind of say in a different way too, you don't need to know what question goes to FMT or what question goes to Arquita. Just ask us. If it's not something we can answer, we will help get you to the right person too. So just know that too. You don't need to feel like you need to categorize who needs to answer what. Just don't hesitate to ask us any question, and we'll answer it or send you to the right person too.
Okay, well, if there's no more questions this afternoon, I will give everybody back 10 minutes of their day. Thank you, Anne, Courtney, and Elena, for agreeing to sit with us for this hour, answering our MBQIP questions. Always appreciate seeing you and speaking to you. Again, if you have any other further questions, please feel free to reach out to them. I'm sure there's more that's going to come up as we move along. So have a great day, everybody, and enjoy the sun if you have it.
Thanks,
you.
Amanda.
Yeah, thanks, everybody.